Throughout this week, we're going to be shedding some light on national issues facing the LGBTQ plus community at large. Now we'll take a local view through two organizations that have been advocating for Brooklyn residents, representing all spectrums of the gay community.
Well, it's an honor to welcome back to BK Live Floyd Rumohr, who serves as Executive Director of the Brooklyn Community Pride Center. Thank you again for coming in.
Thank you.
And with him is another BK Live veteran, Vaughn Taylor-Akutagawa, Executive Director of GMAD, Gay Men of African Descent. Welcome back, gentlemen, and happy Pride Month.
Thank you.
Happy Pride.
Which I did read this month, President Trump has not acknowledged Pride Month. Well,
Surprise, surprise.
It's very out
little
of
interesting
character for our Commander-in-Chief.
I'm just saying. Anyway, so gentlemen, as you reflect back on the past several years, you know, to start off the conversation, what would you say you're most proud of with the LGBTQ plus community?
Sure. We are here. We have survived. We still create a platform, a safe space, not only for ourselves, but for other people. We are there when no one else is, and we keep our eyes on the prize.
I would echo that. I'd say that the thing that I'm most proud of is national marriage equality. It passed the Supreme Court, and I think that was a big hurdle.
So what does it mean right now to run a place like Brooklyn Community Pride in the context of 2017, knowing that we have crossed that substantial hurdle and knowing that there's still lots of fighting and rallying to be done ahead?
That's a complex question because Brooklyn is very different from the other boroughs. 80% of the folks who come into the Brooklyn Community Pride Center are low income. A good proportion of them are people of color, and we saw on one of the earlier slides the high rates of HIV/AIDS infection among communities of color, especially MSMs. We have a program now that we launched in collaboration with CAMBA, an HIV prevention program that focuses on young men who have sex with other men and transgender women, mostly in communities of color. The person to contact there about that would be Jonathan Kimball, the project supervisor. I'd say that's a top priority going forward.
So Vaughn, working in the community specifically with gay men of African descent, and we have these conversations and they present with a whole other host of issues and things that are at the front of their mind, and marriage equality isn't always at the top of that list. And then you introduce the transgender aspect as well, where people are literally dying in the street. So what are the priorities as you see them reflected through the people who come through the doors at GMAD?
For us, it's stabilizing a safe space so that we can actually talk about all these things. We have mental health, substance abuse. We're adding primary care in July. So there's a safe access point that actually talks about who we are. So people can see individuals like them who speak the patois if necessary, speak different languages, but also understand we see you as whole. So we're gonna help you with alignment and bring through, and making sure that younger people have access to these places so they get clarity and understanding.
Gentlemen, you know, in our last segment, Dr. Sweeney was saying that, you know, New York historically, as well as some places on the West Coast, you know, a lot of people in the LGBTQ plus community sort of, you know, make their way naturally to these places. But even here in Brooklyn, even with amazing organizations and the amount of people that we have, what would you say are some of the services that are still missing and are needed?
I think there are lots of services, but folks don't know where or how to get them.
Even in today's climate of social media and texting, and you can, you know, forward it right along to the SMS, it's still hard to get the message out?
Well, that's assuming that some, you know, 80% of folks who are low income have access to technology, computers, or even know how to use them in the case of the elder community. So I think the answer to that is even with the modern age, people are still struggling. Some of our young folks come in for a snack and just use the Wi-Fi.
Yeah. So it is that sort of that person-to-person thing that continues to work best when you have a friend who somehow got clued in and then they bring in other friends and it infects the community in the best way.
Yes.
So looking at our question of the week, we're taking in the agenda and saying, are we there yet?
Right?
So I want to start with you, Vaughn. Where is the there in the are we there yet? What is the sort of pinnacle that you and your organization and like-minded folks are working towards?
Well, I think the great thing is that we're open. There are more people being clear about who they are. There are more conversation around self-definition. That self-definition is the first step in self-control. Floyd and I both create spaces where people can advocate for each other. The next steps would be to really secure housing in this borough. Gentrification is wild and crazy, had me scared a couple of times.
Yeah.
Understanding what access points mean for our people. It's not having a clinic open Monday through Friday, 9 to 5. It's having a space open for people can come in and understand. Having service providers who actually help clients with capacity, understanding how to use the technology, understanding how to pick a doctor, use insurance, versus just blind compliance. Being able to support other people in their family, be able to talk to clergy, and since this is Pride Month, I know my agency will be working with many people in the city council to ensure not only that we have good laws, but those laws are enforced. And the enforcement would look like training providers, police, emergency responders on what it means to be who we are and how we show up.
Speaking of access points, Floyd, I know that you guys do have Wi-Fi and snacks that helps with the team setting, getting people in the door, but you also have a great event that's going to include elders and the young people and be very intersectional that people who are viewing right now can take part in.
That's right on. We have an event coming up. It's our biggest event of the season. I like to think of it as Brooklyn's bash of Pride season, including dinner, dancing, cocktails, and a few surprises that I cannot tell you.
All right.
But it's our 2017 Community Leadership Awards and Gala, and I hope Vaughn and you will join us.
Sure.
Our honorees for the night are Carlos Menchaca and Dr. Dimitri Daskalakis, who is the director of the Department of Mental Health and Hygiene, and they are two incredible champions of the LGBTQ plus community, and we're looking forward to honoring them on the 15th.
All right, that's June 15th. Go to their website. There's still time for tickets and supports.
Absolutely. Any other wonderful events coming up that we need to check out? I mean, it's Pride Month in Brooklyn. You know, how do I sort of key in and support?
Well, there's a free event, too, next
I like free
June
events,
7th.
too.
Yeah,
There
right
you
at
go.
the Brooklyn Community Pride Center. There's food there, too. And I think there will be some performances and other activities. We are sold out. We've started a waiting list, though, so if you're looking to get involved in that, hop on the waiting list, and we'll see if we can take care of you.
Preference for volunteers as well. So if you know a guy. So Vaughn, as we wrap up, I'm just going to ask you, like, let's language ourselves into a better space then. Like, what's on the wish list that the city can provide, that we can knock on Governor Cuomo's door for, that we as people who care can advocate for both of you guys, whatever those needs are?
Mine's going to be money, access, and patience. The money to provide effective programming and structures so that agencies like mine can adapt to meet the new needs and also support our legacy ideas. Access so that we can tell you what our successes are. And patience for us to fumble a bit along the way, but also continue to make sure that bridges like this exist.
All right, continue that bridge for us with the center.
Well, yeah, right on. I'll echo all of that, especially the money part. I don't know if anybody saw Carlos Menchaca's co-authorship of a piece in Crain's magazine referencing how slow the city is to pay city contracts. I think that really needs to be looked at.
This is once they've won in dispensing that money that you're counting on in your budgets. That's slow coming.
Exactly. To give you an example, we've been providing services for elders since July 1, but have not collected a single dime against that contract for the whole year.
As we sit here in June.
As we sit here in June.
Later almost.
And that's a huge problem from the operational perspective of running a nonprofit.
Yeah.
But there's another point that you raised. What is the there? And I think one of the biggest theirs that we have yet to explore is safe spaces, services, understanding of the transgender and gender nonconforming community. I think in some ways they're the group most at risk during this administration, the most vulnerable, and I'm asking myself every day how I can be a better ally.
Awesome.
That's
Thank
a
you.
great
Not just the
question to
bathroom,
start
so,
from.
Yeah, thank you.
And take action. Thank
Thank
you
you.
both for being here. Appreciate it.
Brooklyn Community Pride Center and GMAD.
That's right.